Yeah, listen, gum disease is basically the biggest cause of tooth loss that you get in the population. Obviously, you have caries, okay, which is tooth decay. We're not talking about tooth decay today. We're talking about gum infections. So more than 90% of the population has some kind of gingival or gum problem. Okay, 90% of us. Fortunately, that is not all severe gum disease that's going to give you all these associated systemic health problems. That's just a gingivitis. So a gingivitis is basically bleeding gums, okay, but not the severe kind. So we have I have to distinguish between a gingivitis and a periodontitis, which is the one that you don't want. But with everything, if you have the one that you don't want, there's ways that we can manage it. We'll talk about that. But the gingivitis, not so harmful, and it affects the gums, where your periodontitis affects the gums and it affects the underlying supporting tissue, which is the bone. And the late effect of periodontitis would be then damage of the gum, which goes over to damage of the bone, which gives you loose teeth in the advanced stages, and then you would lose the teeth.
Is it two completely different diseases, or is it a slow progression from gingivitis to at the end of losing teeth?
I think I'm going to try and make it simple, and we'll take the ones that start with gingivitis and then progress to periodontitis. Okay. There are various amounts of different types of gingival and periodontal diseases. I think let's stick to the main line because there are ones that progress that doesn't progress, that basically starts off being immediately destructive in nature. Okay, your more aggressive types. But for most, it will start off with somebody that has a gingivitis, so bacteria form on the teeth, dental plaque, it sits on the teeth. In the normal diet that we have, it will calcify. I always compare it to the inside of a kettle. If you boil that new kettle enough, it has a bit of chalk on the inside. So what happens is the bacteria, which is soft initially and can be easily brushed off, calcifies and it becomes hard. And there is the interesting part. Not everybody that has bacteria on their teeth that calcify, so firstly plaque or calculus, will get periodontal disease. Unfortunately, there must be a susceptibility, and that is your genetic component. So you can have awful oral hygiene. I mean, you cannot brush your teeth for months on end and you will not have periodontal disease. You'll have gingivitis. You'll have bleeding gums when you brush your teeth. You might have a bit of a breath issue that might not look that good. But it will not necessarily progress then to bone loss and the tooth loss part. That's a very complex immune-mediated response. But that, in a way, is what affects your patient that has the systemic health issues. It's obviously a very complicated cascades of inflammation